This abstract's been presented actually this afternoon shortly, and our team here is really demonstrating the efficacy of the combination of Mezigdomide dex with backbone agents such as Bortezomib and Carfilzomib. But in a nutshell, it kind of echoes what we presented last year's ASH when we combined Mezigdomide with daratumumab and also with elotuzumab. And what we're seeing, which is remarkable, I think, is that the combination of Mezigdomide with Bortezomib generated response rates in excess of 70 to 80%, despite the patients having had significant prior Bortezomib exposure. They couldn't be refractory or intolerant to it, but nonetheless, they were all heavily exposed. I think the fact that that was both well tolerated and highly efficacious provided the strong backbone rationale, as it were, for the SUCCESSOR-1 trial, which is ongoing. That's comparing pomalidomide, Bortezomib, and Dexamethasone, which is the standard of care, to Bortezomib, Dexamethasone, and Mezigdomide. And we're very hopeful that that phase 3 trial will meet its primary endpoint of progression-free survival benefit fairly soon, probably over the next several years, hopefully, once accrual to that study has been fully achieved. But that particular aspect of this study certainly provides a strong rationale for SUCCESSOR-1. I think the combination of Mezigdomide dex with Carfilzomib is an even more exciting platform. And I mean that in the sense that many patients will have had prior Bortezomib exposure, but in a significant number of patients with relapsed refractory disease, the use of Carfilzomib as a strategy to salvage them is actually very well established and appropriate. And so in this particular setting, to see the combination of Carfilzomib and Dexamethasone combined with Mezigdomide generating response rates in excess of 80–85% was really encouraging, and again supports the rationale behind SUCCESSOR-2, which is another phase 3 that's really barreling along, enrolling very briskly, comparing Carfilzomib, Mezigdomide, Dexamethasone to the standard of care, which is Carfilzomib and Dexamethasone. And we're very hopeful of results coming from that study, really hopefully as soon as possible over the next several years as those data mature.